On the Medical Watch, it's the end of the COVID-19 public health emergency tomorrow. What does that mean for battling COVID and staying healthy? Chicago Department of Public Health Commissioner Dr. Allison Arwady joins me now live. Hi, doctor.
Hello.
So how happy are you about this? How happy should we be about this? I mean, this really weighed on people mentally. Should we be less worried?
You know, I am the happiest person out there that COVID doesn't need to be the top of mind at this point. It doesn't mean it's gone. It doesn't mean the health department is not continuing to work on monitoring and responding if necessary. But it does mean we are at a different point, and we have vaccines and treatments that can really help keep people out of the hospital, keep people from dying.
Okay, so let's talk about testing, because I know before, at the slightest symptom, people would run out and say, I tested for COVID. Should we be doing that all the time now? There are colds, there is the flu, there are so many different viruses out there. So what do you recommend when it comes to testing?
Yeah, we really do encourage people to continue testing for COVID. Those over-the-counter tests, they work well. They're relatively inexpensive. With the emergency ending, it is possible you may need to buy those more as opposed to them being free. But they're an important tool. COVID is still more dangerous than a regular cold, especially if there are people who are older with underlying conditions. And we want people still, if you've got a positive test, you should be staying home for those 5 days. You should be wearing a mask days 6 through 10. None of that changes, even with the emergency ending. So I do want to encourage people, if you're not feeling well, take a COVID test, put that mask on. It helps stop the spread of whatever you have, but especially if it's COVID.
So what are the hospitals doing differently now that the emergency is over? Anything?
So in many cases, we're seeing less of the universal masking that we've been used to. There are certainly settings that continue to require masks if folks are immunocompromised, et cetera. But we are still very much seeing patients, right? There are an average of 13 Chicagoans still being hospitalized every day with COVID. So it's not over, but it's not at this point a threat of overwhelming our health system. And again, we have the tools. If people are up to date with their vaccines, and if they do get sick, they take one of those early treatments. We really don't see people, for the most part, getting hospitalized, and we certainly don't see them dying. But being up to date with that vaccine is critical.
Okay, let's talk about that more specifically then. Who should be getting the vaccine and when?
Yes, so everybody over the age of 6 months should have a COVID vaccine. And if you haven't had a COVID vaccine since last Labor Day, you're not up to date. There was an updated COVID vaccine that came out right around August, September last year that was made specifically to help protect you for Omicron. That's the type of COVID that's circulating still now. It's what gave us the big problem last year. So if you haven't had a vaccine since Labor Day, you need to get one. And for anybody over 65, if it's been 4 months since your most recent COVID vaccine, you are also authorized to get another one. And for anyone immunocompromised, if it's been 2 months, you are. But for most people, it's getting up to date, having had a vaccine since Labor Day. For those over 65, can get another booster now. For most people, I think, though, we'll be looking at the fall and most likely sort of annual boosters like we do for flu.
Okay, Dr. Arwady, you mentioned in the beginning of the conversation that you're still monitoring for COVID. So if there are any spikes, we're going to know that.
Absolutely. I want to reassure everybody that we are in no way cutting back on monitoring or data work at the health department. We're continuing our wastewater and our variant surveillance. You can continue to go to chi.gov/COVID-. We'll update it every week. You'll be able to see what's happening right up at the top. We're going to continue to have, are we at a low, medium, or a high risk? And if you see us go to medium or certainly to high, you will be hearing that. And we will be advising masks if we were to need, for example. That's a very long way from where we are now. Of course, I hope we don't need to get there again, but no, we are absolutely monitoring and preparing.
Well, thank you for all of your diligence during this emergency, during this pandemic. We really appreciate you, Dr. Arwady.
Thank you so much. Get up to date with your vaccines. That's how we keep this in the past. Thanks.
The important public service announcement, Ben.